Okay, I welcome everyone to this session on Dance for Dementia Awareness with INDAK and Fern-C Gold. I am Dr. Jacqueline Dominguez, and I am a neurologist at the Institute for Neurosciences at St. Luke's Medical Center. We are happy indeed today that we have Stada, who is supporting us to talk about dementia. And it always delights me that there are groups of people, interested organizations and companies who want to promote education about dementia. Specifically today, we will talk about dementia prevention, and we have two exciting parts here, the INDAK and vitamin D supplementation through Fern-C Gold. So how big is the problem of dementia, and why are we even talking about it? With this data in 2015, the WHO actually said that dementia is a slowly growing epidemic. And why is this? You look at the figures here, 10 million affected people in Europe, 9.4 million affected in the Americas. But look at the figure in Asia, it's 22.9 million people with dementia. So this is clearly telling us that more than half of the dementia population in the world actually live in Asia, in low middle income countries like the Philippines. And therefore, for us, it is salient, it is important that we need to understand this problem. And to illustrate the magnitude of the problem of dementia, sabi nila, 1 in every 3 seconds, you count 1, 2, 3, a person is diagnosed with dementia. So that's how big and how fast the problem is and is going to be for everybody. And therefore, everyone, all countries are encouraged actually to move to create a national dementia plan in order to address this problem. So when we hear about dementia, when we hear the word dementia, what do we think about? We think of someone who is forgetting. And what are the common experiences? Forgetting what to say or do. Ano nga ba yung sasabihin ko? I was going to tell you something but I forgot. Ano nga ba yung gagawin ko? Pumunta ako sa kusina para kunin yung something, pero ano nga ba yun? Okay, so things like those, these are common experiences, no? Forgetting recent events. Sino nga yung kasama natin kumain last week noong birthday ni Maria? So details of recent events, misplacing personal items like saan ko ba nalagay yung cellphone? Where are my keys? Where was my wallet? Where did I put my eyeglasses? These are again symptoms of forgetting. Forgetting names of people and places. So you meet someone in the mall maybe or in the restaurant and you wanted to introduce him to someone and then you just forget the name of the person. Or you are telling a story and you just stop because you forgot the name of the person you are talking about, including also same through with places, no? Forgetting a task or an errand. Say you're supposed to, go somewhere else to buy something or to pick up something and bring it to another place, and that can be forgotten. Okay? Forgetting to relay a message or return a call. So may tumawag, sabi, pwede bang pakisabi kay Lola, tawagan ako, and that is missed and not relayed. Or someone calls and somebody supposed to return a call and that call is not returned, okay? And word finding difficulty, again, stopping in the middle of a sentence, looking for the right words to say. So these are common experiences. So it sometimes actually terrifies people to have this experience and think, oh, is this dementia or is this not? Is this part of normal aging or is it the beginning of dementia? And therefore, that's when we start thinking of seeing a doctor, of consulting someone, of engaging in activities that we think would improve our memory. So forgetfulness is almost always associated at least in current times and in current conversations to aging. And this is just a pictogram to show us what happens during aging. So if green is super green is normal, and then the far end, which is this falling off what, brown, yellow leaves falling off the tree is dementia. It is actually a spectrum na hindi naman kaagad-agad biglang nagkaroon ng dementia. So it's a long process from green to yellow to brown, golden brown leaves. So it's a spectrum, therefore, it is important to remember this because there are many things that we can do over this long process of time when dementia is setting in the brains. So what is dementia? It's not only about forgetfulness. It's actually operationally defined as acquired decline in intellect or cognition to which memory belongs in an awake individual that interferes with the person's activities of daily living. So if we tease this sentence into the important points that it is telling us, acquired is very important. So nobody is born with dementia. It is acquired, meaning someone has acquired brain function or facilities in adulthood, and then it slowly is lost. So it is acquired. Second word is decline. So meaning to say, ang isang tao ay dapat narating niya ang sapat na kaalaman or adult brain function again, and then that function declines over time. So it affects intellect or cognition. And intellect or cognition does not only refer to memory, it refers to orientation, executive function, attention, judgment, and problem solving, decision making, all of it, all of what we do in everyday life. Okay, and awake individual meaning we do not diagnose dementia in a person who is comatose. The person has to be awake, observed, testable, can interact, can engage, can look at you, can respond to his name. Okay, and this acquired decline interferes with the person's ability to live independently. Ito ay nakakaapekto na sa kakayanan ng isang tao na halimbawa magluto, pumunta sa palengke, pumunta sa bangko, magbilang ng pera, mag-decide kung magbenta o hindi ng kanyang ari-arian. So these are all activities that are affected, that may be affected when a person has already dementia. Okay? So that's the dementia syndrome. And there are many causes of dementia. And number one, by and large, is still Alzheimer's disease. So marami nagtatanong, ang Alzheimer's disease ba ay dementia? So ang Alzheimer's disease ay isang cause ng dementia. Dementia is the broad term, broad. Siya yung general condition. And under it, meron Alzheimer's disease, may vascular dementia secondary to strokes, yung maliliit na strokes, kaya malalaking stroke na umuulit, vascular dementia. Mayroon Parkinson's disease, may mga ibang Parkinson's disease na nagkakaroon din ng dementia. There is frontotemporal dementia, usually sa mga mas bata ito, mga 50 years old, less than 60 years old. May Lewy body dementia, ito naman ay nakikita sa mga medyo matatanda na, 70, 75. May mga ibang dahilan din or causes of dementia. Depression can actually cause dementia. Kung malungkot ang utak, nagkakaroon ng limot at nagkakaroon din ng dementia kung ito ay hindi iniintindi o nagagamot. Infectious diseases, so alam natin na meron na ngayon dementia ng dahilanan ay HIV. Naririnig din natin ngayon na after COVID, medyo may kaunting limot. Hindi naman ibig sabihin na dementia yon, pero may mga ibang maski na bata na after nagkaroon ng COVID, months after COVID, parang napansin nila na meron kunting decline ng kanilang memory. So wala pa tayong kaalaman masyado tungkol sa dementia and COVID, pero ito ngayon ay pinag-aaralan ng maraming researchers around the world. Ang isang cause din ng dementia is are metabolic diseases, for example, hypothyroidism, vitamin deficiency, particularly vitamin B12 and vitamin D, are associated with cognitive decline and dementia. So when somebody develops dementia or has dementia, it goes through a course and it is progressive. Progressive, ibig sabihin, tuloy-tuloy lang siya, dahan-dahan. na mag-decline ang cognitive function in many years. Some can last 12 years, some can last 9 years, as you see in this slide, in this presentation. But ang gusto kong sabihin dito is what I really want to say here is that there's many things we can do actually for early diagnosis. We need to diagnose dementia early on because by doing that, we can address the symptoms better, we can understand the patient better, there can be better planning for the future, and people who are with dementia who are diagnosed early actually live longer because they're better taken care of rather than disregarded to be just, nag-uulyanin dahil tumatanda na. So it's really important to diagnose dementia early on when the first symptoms are already observed, okay? So, and when I say early, we actually have a stage between normal and dementia. Ang tawag ay mild cognitive impairment or MCI. So this is a very important phase where the person has some forgetfulness but is not yet demented. Okay, so kaya pa, marami pang kakayanan na naiwan na pwede pang trabahuin at pwede pang siyang i-improve. Okay, so we can diagnose early dementia actually when we do lots of tests. Of course, when you come to the doctors, there are many tests that we do. One of that is brain MRI, and you can see here the difference in Alzheimer's disease. This is, if you can see the pointer here, this one in Alzheimer's disease is already small compared to a healthy brain. So these are the structures that degenerate or shrink when a person has Alzheimer's disease. We also have PET scan. This is a very special scan of the brain, and it looks at the ability of the brain to use glucose or sugar. And so we see also here in Alzheimer's disease, hardly there's already lesser of this red. These are the ones that use parts of the brain that use glucose compared to normal. So in normal, there's a lot of red here. So lots of parts of the brain are using glucose. They are active. But in Alzheimer's disease, it's already lesser. And then there's another new special type of scan that we now use, and we can see amyloid. And amyloid is the protein that is most consistently associated with Alzheimer's disease. So nakikita natin dito, amyloid positive, sabi niya, these are the arrows, saying that in these areas of the brain, there's already a lot of amyloid being deposited. And it is this amyloid protein that induces neurodegeneration and therefore dementia syndrome. We also have now blood tests that we use for Alzheimer's disease. It's called the MDS-AD. So it measures also amyloid oligomers in the blood actually, and that can test now whether there is high. If you look at this figure here, it is high in Alzheimer's disease, and it is normal in people who are normal without Alzheimer's disease. Of course, these tests are in addition to what we normally do in the clinic. So we do a lot of memory tests. It's actually called a battery because it's composed of many tests like this one enumerated here. And I want to share with everyone that we already have a Filipino version of all these tests. So most are translated and validated in Filipino. Therefore, they're very usable and practical to use among our elderly patients. And we already have our norms for these tests. So this just to illustrate a person who at age 89, we tested in 2003, April 10, 2003, and her score then was 9. So this is normal, 9 out of 70, because this test counts the number of errors, and the allowed number of errors is 10. So she had 9, so this is normal. But then 7 years later, you see that the number of errors already increased to 14. So it is at this time that we said, oh, this person was already having mild cognitive impairment or even the beginning of dementia. So these are the tests that we do in the clinic or in the center, where we can estimate the amount or the quantity or the severity of memory loss and cognitive impairment. So it's not only about early diagnosis that is important when we look at the spectrum. There is now lots of data to say that if we modify or if we address different risk factors, we can actually prevent dementia to as high as 40%, okay? So, and the approach is life course. Dementia prevention begins in early life. So look here, education. If we modified, if we provided education to everyone, well, at least 10 years, or high school education, then we can diminish the prevalence of dementia by 7%, which is actually very high. Okay, hearing loss, if we mind and treat hearing loss and prevent hearing loss, usually in our local situation is from infection like otitis media. So if these are treated early and hearing loss is prevented early, then we can prevent 8%. Traumatic brain injuries, usually now we know from motorcycle accidents, from sports, from many other forms of accidents, can also be prevented and can prevent dementia, hypertension, alcohol intake, obesity. Of course, in late life, we continue to promote that everyone should stop smoking, because we see that even in late life, if we are able to manage smoking, we can prevent 5% of dementia. Depression, social isolation, physical inactivity, sedentary lifestyle, air pollution, and even diabetes. If we can prevent all of this, it says here, we can prevent, 40% of these are potentially modifiable, okay? So, but we also know that all these lifestyle risks are not the only reason for dementia, of course. There are many risks that are unknown, genes that are unknown. Some have been identified, some are yet to be identified, but they are also contributory to the development of dementia. So we talk about early detection and also now the value of doing a life course prevention for dementia. So in a life course perspective, this is another view of what I was saying earlier, that there are risk factors, those that increase the chance of developing dementia, and there are protective factors, those that diminish the chance of developing dementia or protecting the brain from developing neurodegeneration and dementia. And we all see here all outlined above in red, cholesterol problems, hypertension, obesity, smoking, alcohol, unhealthy diet, TBI, traumatic brain injury, pollution, diabetes. And of course, we add here hearing loss and pollution, right? And below here, we have education, physical activity, mental and social activity. And I think if you look at the life course, it's never too late or too early to do something for brain health. We can do it as early as childhood. We can even do it as late. But of course, it's best that it is done in a life course. So let's be mindful that all these conditions can actually potentially affect the brain, because any or all of them can lead to vascular insults, to neuronal damage. While these ones, the protective ones, can actually probably give us some brain reserves. So there are studies that those who exercise, people who exercise a lot consistently, they actually have better, bigger hippocampal volume, which is the one that I showed in the MRI. Okay, so education also, of course, mental and social activity are really important. Well, now more than ever because of the impact of COVID, okay? So I see, I put here INDAK, and this is not to preempt the other part of this program where Stada prepared this lecture and that INDAK, probably INDAK session or so. But also to just tell you that INDAK combines physical activity, being dance, mental and social activity all together, okay? So I'll talk probably a little bit about that INDAK in the next slides. So in the Philippines, how big is the problem of dementia? This is important to know because this is our data. This is Philippine data already. So in 2010, 2011 up to 2012, we actually did a research in Marikina. So this is Marikina, you see on the map here. It has 2 districts, 16 barangays. It had this population, almost 500,000. But what I wanted to show here that it has a household size of 4.71. Ibig sabihin, there are at least 4 or 5 people living in one household. And that is very important if you try to understand the living situation of elderly people. And of course, elderly population of 19,320 at that time. Okay, so we call this the Marikina Memory and Aging Project. And this project has a lot of data generated from this. It's been very helpful in validating all the tests that we use now, and also estimating the burden of disease. And it's also now a data set that we are collaborating with international cohorts that are doing the same study. And the reason for really studying aging population is because the Philippine population is indeed aging. So if this is in 2010, look at this would be our population as a whole, the blue line. But if you see the green line here, you see that from 2010, it slowly is increasing all the way up to 2030. Okay, and if you look at the 0 to 14 age group, it's almost flat, meaning to say that mas marami nang tumatanda sa atin, pero yung mga babies na lumalabas, ang bilang ng 0 to 14 years old is remaining about the same compared to the increasing population of the elderly. And this makes a problem because we know that in Philippine culture, in our setting, we do really take care of our elderly population, of course, with or without dementia. And as I said earlier, in the household population of 4 to 4.7, which is 4 to 5, that might in the future actually decrease to 3 or to even 2. We don't know. Okay, so we found out in our research, we evaluated 1,361 people, older adults in Marikina, and found really that dementia increases with age. The older the person is, the older is the chance of developing dementia. And for example, 60 to 69, the percent of people with dementia was 6%. Pero sa mas matanda, 70 to 79, naging 15%. And 80 years old and above, it was almost 1/4 or 25%. So meaning to say that as a person grows older, the number of dementia increases, and the chance for having dementia also increases. Okay, so if we put it in this figure, 1 out of 10 of people more than 60 years old has dementia, because it is 10.6%. Okay, so early diagnosis again is important because we can actually take care of them better if they are diagnosed properly. But then come to early intervention or early diagnosis. This is what I wanted to share, that from this data in Marikina, we found that there's also a lot of people who were complaining, and we tested to be forgetful, but they were not yet demented. Okay, so this is 23% or 1 in 4. So if there were 4 people more than 60 years old sitting in front of you, 1 of them would have mild cognitive impairment. And this is where we said, so what can we do for them so they don't develop or they don't progress to have dementia in the future? Okay, so this is the time when we decided, oh, maybe we can try dance. Okay, so the dance was designed to be like this, 8 modules. And this is based on ballroom dances. This is actually crafted by a multidisciplinary team from the College of Human Kinetics, from Dance Sport Philippines, so from neurology, from psychologists, from occupational therapies. We put together a team and designed this, put together these 8 modules. So the 1 module is learned in 6 weeks. So it's 1 hour 2 times a week, since it's 8 modules. So it turned out to be a duration of 1 year. And then we had the participants tested in terms of their memory before and after the program. And we eventually call this INDAK, which stands for Improving Neurocognition Through Dance and Kinesthetics. Okay, so what was good that we eventually found with this INDAK is that it encompasses a lot of, it stimulates the brain in many ways. It visualizes, it makes people imagine. They have to listen to the music and sync with the music. They need to improvise. They need to recall the names of the dance steps itself and the names of the dance steps. Okay, so at the end of each module, they were drilled by the teacher, you know, and then they can choreograph and they can create their own dances. So it's very, very highly stimulating to the brain. It's very enhanced. If we call it, it's an enhanced environment for the brain, okay? So this is how we did it. We invited the 317 people with mild cognitive impairment, invited them to dance. 101 participated and the 106 did not participate in the dance, okay? And this is what we found out. Again, we look at their memory tests. Remember the ADAS-COG and all the tests I showed earlier, they were tested before and after, and we compared those who danced and those who did not dance. And this is what we found out. Look at all their scores in the tests. In the test, they all improved. Those who danced improved, had better memory scores, had better language or naming scores compared to those who did not dance. And more than that, those who danced actually had lower depression symptom scores, okay, as measured by this test called GDS. So it seems to, it's telling us actually that dance can actually improve memory and diminish or even improve depression. So that's one side of the story of maintaining or promoting brain health and preventing dementia, about something non-pharmacological, something that you can do on your own. The next good thing that is always being discussed for prevention is actually diet. So there's a lot of studies being done on diet. And what is emerging actually are Mediterranean diet, keto diet, all sorts of diet. But what is common to all is they just say, and of course, diet is very cultural. So the Mediterranean diet is not our own diet, but the bottom line is it's a colorful diet. So colorful diet meaning fruits and vegetables. So that's the core, and of course, vitamins. What we know now about the role of vitamin D and memory and cognition is that low vitamin D is associated with memory impairment and symptoms of depression. That, for instance, in Europe, levels that are lower than 25, because the cutoff is 30, levels that are lower than 25, there was a 4 times greater chance of developing cognitive decline. And we also found the same in literature from the US. Levels lower than 20 affects the ability in a person to perform focused attention, process information, and perform executive function. So in the overall, vitamin D deficiency doubles the risk for all-cause dementia. And vitamin D is something that can be treated so that we can prevent dementia. So again, all other studies are showing the same thing, that lower vitamin D levels have lower baseline scores in their memory tests, and they have greater decline over time. Okay, so it's important to understand that the role of vitamin D in brain health is very significant. Okay. So treatment of, therefore it needs to be treated. So severe vitamin D deficiency, it's 50,000 units of oral vitamin D once a week for 2 to 3 months. And mind you, in patients on whom we test for vitamin D, elderly patients, there's a lot actually, majority. I couldn't say how really exactly now, but as far as I remember, many patients, elderly patients in particular, during the pandemic, actually because of limitation in sun exposure, because of the change in diet, have lots of them have vitamin D deficiency. And the goal when we treat vitamin D deficiency is to target 30. So it's usually 30 to 40. So 30 to 40 is good. So, and maintain them on 80 to 100 international units per day. So for mild to moderate deficiency, target first 10 to, which is 20 to 24. There's a shorter treatment interval and lower dose. But it is, of course, best and very ideal that once we institute treatment for vitamin D deficiency, we need to follow up the levels at least after 3 months so that we can see that they have actually normalized. Okay, so in general, we know that vitamin D is always associated with bone health, with muscle, but now we must also consider that it is associated with brain health. So who would take multivitamin with vitamin D supplementation? So if you have a friend who is male, retired, smoker, you know, with all this metabolic syndrome, hypertension, cholesterol problem, you know, for which he takes all these statins and sartans for medication, and like this person is a candidate for taking vitamin D supplementation. And if there was a family, younger, say 50 years old, who works from home, meaning stays indoor most of the time, even if she's not a smoker, but it's already post-menopause, it's also pre-diabetes, and has some mild forgetting, and mom has a diagnosis of Alzheimer's disease, sometimes exercise during the weekends. So again, this kind of profile would be recommended to take vitamin D supplementation. Okay, so as we say, and we probably heard it over before, that a healthy brain sits on a healthy body. Okay, so sources of vitamin D, unfortunately, are not very common, accessible, or affordable, at least in the local setting. So trout, diba? Saan ka makakuha? This is freshwater fish. Mahal kaya ng mga freshwater fish. Salmon, white mushrooms, okay? So we have now at least the more common vitamin D fortified milk, but not all of us, not Filipinos are not really milk drinkers. We have cereals fortified with vitamin D. We have canned sardines. Yes, we eat a lot of sardines. Egg, that's very available to us. Liver beef, canned tuna, and cheese. But you see that these sources are sort of, if you look at international units per serving, they're less than 200. So they're not actually enough. And this is the reason why for those with vitamin D deficiency, notwithstanding for whatever reason, for diet or for anything, for lack of exposure, should really receive vitamin D supplementation. And it's good enough that there is a preparation that combines multivitamins, okay, with zinc for the immune system and vitamin D, again, for all its benefits on bone, on muscle, and in the brain, okay, which is called Fern-C Gold. So let me just summarize what we just talked about, that dementia is a global concern, and I'm really happy that dementia is the topic today, that many people are wanting to know more about dementia. It's also going to be a problem in the Philippines. In 2010, we documented that 10.6% of Filipinos more than 60 years old had dementia. Dementia is a progressive disease, therefore, it doesn't happen overnight. There's a lot of time for us to promote early diagnosis. So when somebody complains about memory loss or forgetfulness, let's please mind it. Let's not disregard it and just say it's part of normal aging. It can be part of normal aging, but it can also be the early beginnings of Alzheimer's disease, and we need to know that. Prevention is still possible, notwithstanding with the treatment of modifiable risks that we have shown: low education, cholesterol, diabetes, pollution, hearing loss, traumatic brain injuries, vitamin D deficiency, including that dementia prevention is a life course approach. So ngayon pa lang dapat iniintindi na natin kung paano magkaroon ng brain malusog, no? A healthy brain when we grow older, because by the time we are already old and dementia is there, lots of pathologies are already in the brain and there's probably no turning back. Okay. So what are these life course approach? One of them is, of course, physical exercise, and INDAK, as I said, INDAK incorporates all: socialization, physical exercise, emotional, the component, all things that we think that can improve memory, continue to educate, continue to learn, continue to read, continue to stimulate the brain in many ways in an enriched environment. And of course, if at all, avoid or decrease depression symptoms, well, sleep well, have a healthy diet, and have some vitamin D from some vitamin D supplementation and from sunshine. Okay. So, because vitamin D is indeed important for brain health. Okay. So I'd like to thank all our participants from Marikina for cooperating with us and allowing themselves to be our study area, study participants, and where we have generated all this data that we can say is Filipino. So I would also like to thank the research team for St. Luke's Institute for Neurosciences, the DOST-PCHRD, and the Institute for Dementia Care for supporting these projects. Thank you very much.
Magandang araw! Ako si Teacher JP.
At ako naman po si Teacher Mean.
Kami ang mga INDAK teachers. INDAK stands for Improving Neurocognition through Dance and Kinesthetic.
Today, INDAK, in cooperation with Fern-C Gold, would like to share with you our campaign in providing older adults not only with a strong body, but also with a sound mind. Fern-C Gold is made with vitamin C and zinc for immunity, and now with vitamin D3 for stronger bones and a healthier mind. As people get older, brain functions like thinking, remembering, and reasoning start to decline. Sa culture nga natin ng mga Pilipino, common na lang or sinasabi na part of aging yung pagiging makakalimot. However, yung sobrang kalimot may actually be a symptom of a disease which we call dementia.
Ang INDAK ay isang structured and modular ballroom dance program proven by research to help prevent dementia and improve memory and functionality of older adults. Kaya ngayon, samahan niyo kami ni Teacher Mean na matutong sumayaw and dance for our brain. Tara! Let's INDAK! Ngayon, ang pag-aaralan natin ay Cha-Cha-Cha Dance. Ang Cha-Cha-Cha ay isang Latin dance na nagmula sa Cuba. Ito ay isang energetic dance at kilala siya dahil sa kanyang triple step or cha-cha-cha.
Yes, and although we know cha-cha-cha as a partner dance, in our INDAK module, we will be modifying the dance to be a solo dance.
Ngayon, ituturo namin sa inyo ang Latin American cha-cha-cha. Okay, ang importante sa Latin American cha-cha-cha para mas madaling matandaan ni brain yung bilang. Okay, ang iisipin lang natin na bilang ay 1, 2, 1, 2, 3 or pwede ding 1, 2, cha-cha-cha. Okay? So yun yung bilang na tatandaan lang ni brain. Okay, mamaya magbibigay kami ng mga figures sa INDAK. Importante na matandaan or ma-memorize ni brain yung mga pangalan ng figure. So ngayon, ipapakita namin ni Teacher Mean kung paano i-read yung 1, 2, 1, 2, 3 sa footwork. Okay, so yung 1, 2, dalawang normal step, magi-start tayo sa kaliwa. 1, 2. Then ang triple step, magsisimula pa rin sa kaliwa. 1, 2, 3. Then after, meron siyang right side. 1, 2, and 1, 2, 3. So tuloy-tuloy lang siya, paulit-ulit lang siya na 1, 2, 1, 2, 3 or 1, 2, cha-cha-cha. Okay? One more time. And go. 1, 2, and 1, 2, 3. 1, 2, and cha-cha-cha. 1, 2, cha-cha-cha. 1, 2, cha-cha-cha. So, yan lang ang bilang na tatandaan ni brain sa buong Latin American cha-cha-cha. Ituturo namin ang figure 1. Ang figure 1 ay basic. So, huwag nyo kakalimutan ang pangalan basic. Okay. So, i-apply natin yung bilang pa rin na 1, 2, 1, 2, 3 sa basic step. Okay. Ang basic step, magsisimula sa kaliwang paa, magra-rock step forward. So, ano yung rock step? Magpo-forward left, then magi-stomp ang right back. So, rock step. So, yun yung rock step. So, pwede din siyang bilangin na 1, 2. Okay. So, ano ang magre-represent ng 1, 2, 3 or the cha-cha-cha? Magi-step tayo ng triple step going to our left. So, step, close, step. Okay? One more time. So, rock step forward. 1, 2, cha, cha, cha. Okay. Now, since free leg ang kanang paa, magra-rock step ang kanang paa paatras. 1, 2, then triple step papunta sa kanan. Cha, cha, cha. Okay? One more. Pagduktungin natin. And go. Rock, step, cha, cha, cha. Rock, step, 1, 2, 3. Again. 1, 2, 1, 2, 3. Rock, step, cha, cha, cha. So, yun yung figure number 1. Basic. Ngayon, tuturo namin ang figure number 2. Ang pangalan niya ay New York. Okay. So, ang New York, so, start pa din tayo sa kaliwang paa. Lahat ng rock step pa forward. Kasi kanina dun sa basic, ang kaliwa, rock step forward, ang kanan ay rock step back. So, ngayon, lahat daw ng rock step or yung 1, 2 na count ay pa forward. Pero, okay, so ito yung pero. Yung left, magra-rock step forward, haharap sa kanan. So, ito yung kanan. Yes, rock step. Okay, one more. And go. Rock, step, then cha-cha pa din papunta sa kaliwa. And cha, cha, cha. Now, ang kanang paa, magra-rock step forward, haharap sa kaliwa. And rock, step, cha-cha side, cha, cha, cha. Okay? So, parehong rock step forward ang New York, pero humaharap sa side. Okay? So, gagawin namin Teacher Mean. And go. 1, 2, 1, 2, 3, rock, step, cha, cha, cha. Okay, now, gawin nating mas exciting. Bakit ba New York ang pinangalan sa figure na to? Kasi, yung may action siya ng kamay na kinuha kamukha ni Liberty. So, ang tawag ko doon kay Madam Liberty. So, si Liberty, di ba, may hawak na libro, nakataas ang isang kamay. So, para mas madaling matandaan ni Brain kung saan nahaharap, yun yung kamay na tataas. So, rock step left forward. Saan haharap? Sa kanan. Kung saan haharap, yun yung kamay na tataas. So, ang itsura ay rock, step, cha, cha. Harap sa kaliwa. Rock, step, cha, cha, cha. So, iisipin ni Brain saang posisyon haharap, anong kamay ang itataas. Can we do it one more time, Teacher Mean? New York, and go. Rock, step, and cha, cha, cha. Rock, step, and cha, cha, cha. Okay, so now, itry natin iduktong ang figure number 1. So ano nga yung figure number 1? Basic. Then figure number 2, New York. Okay? Sige, sabayan ko si Teacher Mean. Basic, and go. 1, 2, and cha, cha, cha. 1, 2, New York, go. Rock, step, and cha, cha, cha. Rock, step, and cha, cha, cha. So ngayon, magpuproceed na tayo sa figure number 3. Pero bago tayo tuluyang pumunta sa figure number 3, try mo natin i-recall yung naunang dalawa. So una ay basic, pangalawa ay New York. Ngayong pangatlo, tatawagin natin siyang hand-to-hand. Okay, para mas madaling tandaan ni Brain yung hand-to-hand, ang hand-to-hand ay totally opposite ni New York. Okay, so tandaan nyo ha. So magka-kontra si New York or hand-to-hand para mas madali lang siyang matandaan ni Brain. Okay, now, kung ang New York, okay, unang pagkakaiba ni hand-to-hand kay New York, kung ang New York ay nagra-rock step forward left, humaharap sa kanan, si hand-to-hand naman, rock step back, haharap sa kaliwa bago tayo gumawa ng triple step papunta sa side. So, ang itsura niya, magra-rock step back daw ang left, haharap sa kaliwa. Then, cha-cha-cha side. Cha-cha-cha. Okay. So, kanan, rock, step back, haharap sa kanan. Rock, step, cha, cha, cha. Okay? So, gawin natin siya ng tuloy-tuloy. So, ang hand to hand, start sa left, rock, step back, harap sa left. Go! Rock, step, and cha, cha, cha. Rock, step, and cha, cha, cha. Okay. So, sa footwork, kabaliktaran siya ni New York, pati sa kamay. Magkaiba si New York at hand to hand. Kung si New York ay tumataas ang kamay, si hand to hand naman pababa. So, mag-rock step, back ang left, nasa baba lang ang kanyang kamay. So, rock, step, and cha, cha, cha. Rock, step, and cha, cha, cha. Okay? So, lahat ng kabaliktaran ni New York ay figure number 3, hand to hand. Okay? So, try natin iduktong yung tatlong natutunan natin. So, ano nga yung mga yon? Basic, New York, hand to hand. Alright? Okay. So, bawat figure gagawin natin tigda 2 ulit. Okay? So, basic. 5, 6, 7, go! Rock, step, and cha-cha-cha. 1, 2, and 1 more time. 1, 2, and 1, 2, 3. 1, 2, New York, go! Forward, and cha-cha-cha. Forward, and 1 more time. Forward, cha-cha-cha. Forward, hand to hand, atras, back, and 1, 2, 3, back, and cha-cha-cha, back, and cha-cha, last, back, and cha-cha-cha. Okay? So, meron na tayong tatlo. So, para mas exciting, itry muna natin itong tatlong figures na to sa tugtog.
So, natuto na po tayo ng 3 figures para sa ating cha-cha-cha dance. Una, basic. Pangalawa, New York. And pangatlo, hand to hand. Ngayon, subukan naman natin siya with the music. But before we do that, I would just like to say na tandaan natin yung bilang na 1, 2, 1, 2, 3, or 1, 2, cha-cha-cha. Iba po ito sa bilang na ginagamit sa competitive ballroom or dance sport, which is 2, 3, 4, and 1. Again, this is modified for our INDAK program.
So, susubukan na natin yung tatlong figures na tutunan natin ng may tugtog. Alright? Okay. Music. Alright. Basic, New York, hand to hand. Okay? Pakinggan mo natin tugtog. 1, 2, 1, 2, 3, 1, 2, cha-cha-cha. Ready? Basic. 5, 6, 7, 8. 1, 2, cha-cha-cha. 1, 2, 1, 2, 3. Rock, step, cha-cha-cha. 1, New York, forward. Forward, cha-cha-cha. Forward, cha-cha-cha. Rock, step, cha-cha-cha. Rock, step, hand to hand, atras, back. Cha-cha-cha, back. Cha-cha-cha, back. Cha-cha-cha, 1, 2, cha-cha-cha. So, yung figure number 4, tatawagin natin siyang spot turn. So, meron ng word na turn. So, iikot na tayo sa pwesto. Okay. Now, ang spot turn, yung first part niya, para mas madali nating ma-recall, para siyang basic lang. Rock, step forward, cha-cha-cha, going to your left. Okay. So, from this position, ang free leg natin ay kanang paa. So, para lang din siyang New York, ang kanan, magra-rock step forward, pero gagawa tayo ng pivot turn. So, paano yon? Rock step forward ang right, forward. So, ano yung pivot turn? Tandaan nyo, para mas madali, susundan nyo yung left direction nyo. Di ba? Pag nagbabike tayo, pag liliko tayo pa left, susundan ang left shoulder. And step. Okay? One more. Dun sa part na yon. So, free leg ang kanang paa, magra-rock step forward right, pivot to your left. Then, ilalagay nyo agad yung bigat ng katawan nyo or yung weight nyo. Okay? One more. From the start. So, rock step forward left. Rock, step, cha, cha, cha. Forward, pivot. Now, yung kanang paa nyo, mag-cha-cha-cha tayo, papunta sa kanan. Side and cha, cha, cha. Okay? One more time. From the top. Okay? So, start sa left. Go. Rock, step. Cha, cha, cha. Forward, right. Rock, pivot to your left. Then, cha-cha side right. Cha, cha, cha. Okay? So, yung umpisa niya, para mas madali, matandaan, parang basic. Okay. Then, followed by rock, step, forward, right, na humaharap sa kaliwa. Then, ikukontinue, pivot, turn to your left. Then, cha-cha or triple step going to your right. Okay, one more time. So, medyo mas komplikado ng konti. And, this is pattern. And, go. Rock, step, cha-cha-cha, forward, pivot, left, and cha-cha again. Rock, step, cha-cha-cha, pivot, turn, cha-cha-cha. Okay? So, that's the figure number 4, spot turn. So, ngayon, figure number 5. So, ang figure number 5, ang pangalan niya or ang tawag sa kanya ay lead and follow. So, medyo unique si lead and follow at saka mas madali siyang matatandaan ni brain. Kasi gagamit tayo ng tatlong triple steps or tatlong cha-cha-cha. So, ano ibig sabihin nun? Cha-cha 1. Cha-cha 2, cha-cha 3. So, tatlong magkakasunod na triple step. Alright. Sige. Papakita ni Teacher Mehan. Okay. So, ang una natin ay magra-rock step forward left, pero magpipivot tayo papunta sa kanan, balikat. So, para siyang spot turn. Medyo may kamukha siya kay spot turn. Pero pivot, magpipivot lang yan siya. Okay. So, sabi, rock step forward left, pivot to your right. So, sundan ang right shoulder. So, magiging itsura niya ay forward pivot to your right. Okay? One more time. Okay. So, forward left, then pivot to your right. Okay. So, ang importante dito, pag pivot nyo, kailangan apakan nyo agad yung kanang paa nyo or lagyan nyo agad ng weight nyo. Okay, one more time. And go. 1, 2. So, ang weight namin ay nasa kanang paa agad. Kasi, dito na natin gagawin yung tatlong cha-cha. So, since free leg, yung kaliwang paa, siya yung unang magti-triple step. And go. Cha, cha, cha. Then, kanan naman, pangalawa. Cha, cha, cha. Then, yung pangatlo, left again. Cha, cha, cha. Okay? So, one more. Simulan natin. Okay. So, pivot. Tandaan po natin na pivot, then tatlong triple step or tatlong cha-cha. And ready? And go. 1, 2, cha-cha 1, cha-cha 2, cha-cha 3. Okay. Pero hindi pa tayo tapos. Bakit? Kasi kailangan natin bumalik sa pwesto natin. Okay. So, kung mapapansin nyo, si Teacher Mean, lahat ng bigat ng katawan niya ay nasa kaliwang paa niya. So, ang free leg natin ay ang kanang paa. So, magfo-forward ang kanang paa, then magpipivot naman tayo to our left. So, 1, 2. So, the same thing. Pagka-pivot, kailangan i-transfer agad yung weight. 1, 2. So, para makabalik, kailangan natin gumawa ulit ng tatlong cha-cha. Ngayon naman, start sa kanang paa. And go. Cha-cha 1, cha-cha 2, cha-cha 3. So, nakabalik na sa pwesto, yun na yung buong figure na lead and follow. So, gawin natin siya ulit. Okay, gagawin namin ulit. So, start sa kaliwa, pivot turn, and go. 1, 2, cha-cha 1, cha-cha 2, cha-cha 3. 1, 2, cha-cha 1, cha-cha 2, cha-cha 3. So, pwede natin siyang ulitin. And go. 1, 2, cha-cha 1, cha-cha 2, cha-cha 3. 1, 2, cha-cha 1, cha-cha 2, cha-cha 3. Okay, so yun ay lead and follow. Ang last figure natin for today ay Cuban breaks. Okay, so medyo unique si Cuban breaks. Bakit? Kasi siya lang yung step or siya lang yung figure na hindi natin gagamitan ng triple step. So, puro lang siya rock step forward. So, ipapakita muna natin na nakaharap yung Cuban break. Okay. So, mag-start pa din sa kaliwang paa, mag-rock step forward, pero slightly pa-diagonal lang siya. Okay? So, left daw, pa-forward is slightly diagonal sa kanan. So, ito yung direction niya. And go. Rock, step, close. So, kanan naman, diagonally papunta sa kaliwa. And rock, step, close. So, kung napansin nyo, hindi siya ginamitan ng triple step. So, bakit siya tinawag na Cuban break? Kasi nag-forward ka, nag-break, para bumalik sa pwesto. Nag-forward break para bumalik sa pwesto. Okay? So, ngayon, papakita namin ang Cuban break ng nakatalikod. Okay? So, start sa left, diagonal sa right. And go. Rock, step, close. Forward and close. Forward and close. Forward and close. So, yun si Cuban break. So, si Cuban break, pwede natin siyang laruin or lagyan ng variation. So, pwede natin siyang Cuban break na mabagal or Cuban break na quick. So, may Cuban break slow at saka Cuban break quick. So, yung Cuban break quick, slow kanina, sa slow muna tayo. So, ang itsura niya, di ba? And go, forward and close, forward and again, 1, 2, close, 1, 2, close. So, pwede natin siyang laruin. Gawin natin siyang quick. So, the same footwork, bilang lang or yung tempo lang ang mababago. So, ang magiging itsura naman niya, and go. 1 and 2 and 3 and 4, 5 and 6 and 7 and 8. So, pwede kayong mag-Cuban break slow or mag-Cuban break quick. So ngayon, itatry natin i-connect yung figure number 4, 5, and 6. So ano nga yung mga yon? Spot turn, lead and follow, Cuban break slow, at saka Cuban break quick. Okay? So itatry natin na wala muna siyang tugtog. Alright. So, bawat figure gagawin natin ng tigda-dalawang ulit muna. Okay? So, we will start sa spot turn. 5, 6, 7, go! Rock, step, cha-cha-cha, spot, turn. And again, rock, step, cha-cha-cha, spot, turn. Lead and follow, rock, step, cha-cha 1, cha-cha 2, cha-cha 3. Rock, step, cha-cha 1, cha-cha 2. One more time. Rock, step, cha-cha 1, cha-cha 2, cha-cha 3. Rock, step, cha-cha 1, cha-cha 2. Cuban break is slow. Forward and close. Forward and again is slow. Forward and close. Forward and quick. And 1 and 2 and 3 and 4, 5 and 6. Last one, go. 1 and 2, 3 and 4, 5 and 6, 7, 8. Okay? So, natutunan natin yung 6 figures. So, bago natin siya gawin ng tuloy-tuloy, i-recall muna natin yung mga pangalan nila. So, number 1, basic. Number 2, New York. Number 3, hand-to-hand. Number 4, pattern. Number 5, lead and follow. At yung huli, Cuban break slow at saka Cuban break quick. So, gagawin natin lahat siya ng may tugtog. On my cue, basic. 5, 6, 7, go. 1, 2, cha-cha-cha. 1, 2, 1, 2, 3. 1, 2, cha-cha-cha. Ready for the New York. Forward, cha-cha-cha. Forward, one more time. Forward, cha-cha-cha. Hand to hand, atras. 1, 2, cha-cha-cha. 1, 2. Again, 1, 2. Last one. 1, spot turn. Forward, cha-cha-cha. One more time. Forward. Lead and follow. Rock step. Cha-cha 1, cha-cha 2, cha-cha 3. Pivot turn. Cha-cha 1, cha-cha 2. Again. 1, 2. Cha-cha 1, cha-cha 2. Last one. 1, 2. Cha-cha 1, cha-cha. Cuban break slow. Forward and close. Forward and again. Forward and close. Cuban break quick. 1 and 2, 3 and 4, 5 and 6. Last one go. 1 and 2, 3 and 4, 5 and 6, 7, 8. Alright.
So there you have our 6 figures for dance 1, which is cha-cha-cha. Siguro iniisip nyo na para lang pala itong normal na sayaw eh. Magkakabisa kami ng figures tapos sasayawin namin. Pero what makes INDAK really effective and special is that besides teaching you dance figures, we conduct cognitive drills to challenge the mind and your thinking. Isa sa mga cognitive drill na ginagawa namin ay tinatawag na shuffling. Ano ba ang shuffling, Teacher JP?
Okay, yung shuffling, yung mga natutunan nating figures, sasayawin natin siya ng hindi in order kung paano namin tinuro sa inyo. So, sasayawin natin yung 6 na figures, then isa-shuffle siya ng teacher. So, dapat ready yung brain nyo na i-catch yung susunod na figures na sasabihin ng teacher. So, in any order siya. So, kaya sabi ko kanina, importanteng i-memorize yung names ng figures. Tapos, hindi lang names, paano siya ginagawa. So, ngayon, magbabato lang ako ng mga iba't ibang figures na yun yung gagawin natin. Alright? So, ito-try natin siya agad with music. So, exciting to.
Try nyo rin po. Sabayan nyo kami. Makinig mabuti.
So, let's enjoy. Feel the music. 1, 2, 1, 2, 3. 1, 2, cha-cha-cha. Ready? On my cue, basic. 5, 6, 5, 6. Basic, go. 1, 2, cha-cha-cha. 1, 2. Basic pattern next. Stop turn. 1, New York. Forward, hand to hand. Good. Lead and follow. 1, 2, cha-cha 1, cha-cha 2, cha-cha 3. 1, 2, cha-cha 1. Cuban break, quick. 1 and 2, 3 and 4, 5 and 6. One more time. 1 and 2, 3 and 4, 5. Basic, ready, go. 1, 2, cha-cha-cha. Cuban break is slow. 1, 2, close. 1, 2, again. 1, 2, close. 1, hand to hand. 1, 2, cha-cha-cha. 1, 2, cha-cha-cha. 1, 2, cha-cha-cha. New York. Forward. Other side. One more. Okay, spot turn na. Rock step, cha-cha-cha, spot turn, basic. 1, 2, cha-cha-cha. 1, 2, cha-cha-cha.
If you want to win exciting prizes, join our contest and submit your dance video online. You can submit your video through Facebook, just tag Fern-C online, and you can also email us at ferncegold@gmail.com. Kindly refer to the competition mechanics for more information.
We hope you enjoyed exercising your brain and body with us today.
In behalf of INDAK and Fern-C Gold, made with vitamins C and zinc for immunity, and now with vitamin D3 for stronger bones and a healthier mind, we would like to say thank you and see you in our next video.